Great. I will call the Town of Mancos Board of Trustees meeting to order. It is 7 o'clock and it is January 22nd, 2025. Will everyone please rise for the Pledge of Allegiance and a moment of silence.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. And thank you, Nick. My mind went completely.
You're good. You're good. I saw you panicking. Okay.
Alrighty. Okay. This is. All right. Will the clerk please call the roll?
Mayor Cindy Simpson.
Here.
Mayor Pro Tem Brent McWhorter. Trustee Andres Esparza.
Here.
Trustee David Payton.
Here.
Trustee Daniel Hennick.
Here.
Trustee McMinn.
Here.
Trustee Corey DeBoer. Student Liaison Olivia Jukes.
All right. The first item on the agenda is approval of the agenda. I would look for a motion and a second.
I'll make a motion to approve the agenda for January 22nd.
Second.
Okay, we have a motion and 2 seconds. All in favor say aye.
Aye.
Any opposed? All right. Next item on the agenda is a presentation by Joe Thine. All right. And Joe, you're the CEO of Southwest Health System.
Good evening. Good to see many of you again. Thanks for having me here. Jason, thanks for running things. And some things I'll go through quickly. Slow me down if you want to spend a little more time on anything, and certainly interrupt or ask questions if you have them. I'll give you an update on where we've been a little bit over the last year, and then also just a few highlights of where we're heading in the future. So one of the big focuses we've had in the last 18 months is recruiting physicians and advanced practice providers to the community. We've been tracking our progress since August of last year. This is as of late in December. We had a total of 106 candidates, mostly physicians that have taken some interest in looking at Southwest Colorado. You'll see in a moment, we've really completed our first wave of a recruiting plan, but we still are talking to candidates. We've completed 28 interviews, made 18 offers, 17 of which have been accepted. We actually made a 19th offer 2 days ago, and it was accepted yesterday. So I have another internal medicine physician that will be coming to the community later this year. Go ahead. This is a list of providers that are coming. About a year ago, a little over a year ago, we went to our board and said, this is a plan that we think we can execute on in terms of needs that the community had at the time and how we intended to fill them. And what you'll see over on the left is all of those circles have turned to a dark green, which means we've now got a contract signed. You can see the names of the physicians that are starting or have started. And actually all but Eve Bruneau have started. Dr. Bruneau will be starting, I believe, in the first week or so of February as our third general surgeon. So excited to be welcoming folks to the community. Do you want to go ahead? Some of the new outpatient physicians that you'll be seeing in the community, Dr. Bernard and Dr. Megan Viquez, are both family medicine physicians with a fellowship in obstetrics. So they've spent additional time training in C-section, OB, and deliveries. Dr. Hirschman actually lives in the Mancos area. She commuted out of the area for about 10 years to go work in the Hopi Reservation and was excited to be able to come and serve the community that she's a part of. So she started last summer, focusing her practice on older adults. We have a podiatrist who's joined us, Chris Jetter. He and his family are renting in the Mancos area as well. And he's got some special training in foot and ankle surgery. So he's doing some minimally invasive ankle scopes and other surgeries that we've not had the opportunity to do at Southwest in the past. And Dr. Watt joined us as well. The next two slides will just tell you a little bit of a picture about what we planned for and then what's been occurring over the year. So as you look from left to right, you can see different service lines within the hospital. The percentage is the percentage of growth or number of people or visits or encounters we expected from 2023 to 2024. If you go to the next slide, you'll see that in still the dark blue, but the beige bars are through, I think it's the end of November, where the actual growth was. And you can look service line by service line. Things varied. Some are a little bit greater than what we expected. Some are a little bit less. I draw your attention to the kind of middle that I've circled, which is adjusted patient days. When we look at all the activity in the hospital, x-rays, labs, patients that are spending the night at the hospital, all the hospital-based activities in healthcare, that can be kind of reduced to a number that's adjusted patient days. And so when you take all the activity in the hospital, we plan to grow by about 5%. And through the end of November, that's what we were on pace to do. Another area that we've really been paying attention to is attracting and retaining people to work in the healthcare system. And so this is looking at our retention rates. Each of the bars that are on there for the month are the number of separations of employees we've had. The line that's going across each dot represents the retention of employees over the last 12 months. And you can see that that line has been slowly creeping up and is actually higher than where it was a couple of years ago. And so at the end of November, we had retained a little over 76% of our workforce. Not shown here on slides, we measure the same thing for nursing, and our nurse retention rate over the last year is a little over 91%. So we've done an incredible job, and kudos to Lisa Gates, our chief nursing officer, and her team for really doing a great job attracting and retaining nurses. Go ahead, Jason. A little bit on outside funding. You can see a lot of the things to the left. Another area we've looked at is where we can seek partnerships, whether it's grant funding, philanthropic, or others. And I'll touch on some things we're doing in Mangus, but I want to thank you as the town for working with us on hooking up some generators at our building. To really, through the end of last year, we had about $700,000 worth of outside funding requests. We brought in almost $250,000 of outside funding. The large gap between those two is a large congressionally directed spending request that both Senators Bennett and Hickenlooper supported to help address some of the aging infrastructure at the hospital and also set us up for some future projects. So obviously with the federal government doing continuing resolutions, we're still waiting for a final budget to be passed in Washington to see that. When we started capital planning for 2024, our identified need, not including the building's infrastructure, was about $3.5 million worth of capital needs. So replacing equipment that we already have, not even considering new things that we might want. I won't walk you through all the things that we did, but our budget coming out of the year before was really slim on a capital side. And so we only planned for about $200,000 in capital spend. We spent a little more than 50. We did some things right at the end of December. But what's interesting is when I talked to our physicians and medical staff, the first thing we did last year was replace a dumpster. So the dumpster was so old that the garbage company wouldn't haul it off anymore because they were afraid that the garbage would spill out the bottom because it wouldn't hold. And then the last thing we did, we actually had a vehicle that burned, and we received some insurance money for that. But the last thing we did was replace a vehicle. So when I talked to our physicians, I came in and we bought a dumpster and a car. And we're a healthcare provider. So, I say that tongue in cheek, but we still have a ways to go in terms of figuring out sustainably how we operate the entity and replace the equipment and capital that's needed. Also been working on some policy advocacy work. So within Colorado, there's a really strong community of rural independent hospitals that want to serve the communities that they're a part of and have local control, and we're certainly one of those. A group of CEOs got together last year, a little over a year ago, formed a small group, not a formal structure, not a formal entity, but branded ourselves Colorado's Rural Futures. We actually went to all of our peer hospitals around the state, large system specialty hospitals, rural hospitals, and said, if we can all pull some money together, we think we can do some good work to try and understand what policy levers can be pulled in Denver at a state level to help support rural hospitals within our state. And really the work was kind of born out of this idea that it shouldn't matter where you live, you should have access to great health care. And so this has led to, over the last year, and I'm really proud of the hospitals in Colorado. So every single hospital and health system in the state contributed to that. The Colorado Health Foundation, seeing that unified desire to support rural healthcare, came in and provided some additional funding. We worked with the University of Colorado and their Farley Center for Health Policy to assess policies in our current state, the political landscape, policies that have been passed in other states, policies that have failed in other states, to really try and understand what may be possible in the coming years within our communities and what the really big needs are that may be able to be addressed at a state policy level. Stay on that slide for just a second, Jason. That's all right. There's 3 areas that we identified. Financial viability is one. Access to capital, I just talked about our needs locally. That's not unique to Southwest Health System. The piece that was really interesting out of our work was this need for leadership and governance support. And it was a recognition not that we don't have great people that can lead in rural communities, but it was a recognition that, one, healthcare is really, really complex in America and in our state. And there's so much consolidation happening within healthcare right now that young people entering a leadership career or some people entering a governance role are really not on a track to prepare to run an independent hospital. So if you think about our other healthcare resource in the community, Mercy, they're part of a large health system, Common Spirit. If you're a governing board member there, you don't have the same fiduciary responsibilities that you have if you're a board member at Southwest Health System. And just like you as town trustees have a fiduciary responsibility here, our board members have the same for our hospital. And governors who are maybe serving on boards in large health systems or hospitals of large health systems are not necessarily prepared to then govern a small hospital in a small community. And the same is true of leaders. So we met with an oncology team today from Common Spirit, and they have a whole oncology service line. And the leadership in that service line is growing from within, but nobody in that room reported directly to a board. And so the leadership development that's happening in healthcare isn't necessarily preparing people to lead rural communities and have the same set of skills and experiences. So it was a really interesting acknowledgement that how we lead in rural communities is really important in terms of healthcare sustainability. Just briefly touch on Medicare Advantage. We stopped doing business with Humana many years ago. They have announced that they're exiting the entire Southwest Colorado market. So if somebody had Humana for Medicare Advantage, they'll no longer have an in-network provider, be it Durango or Cortez. They may not even be able to purchase that product. Cigna has a product line called Cigna Choice. They also decided to exit the market. I believe they have some other products in the market. Even before those were announced, we're starting to collect some data around how Medicare Advantage plans behave in the market. We know Medicare Part A and B are very consistent in terms of what they cover for patients, very consistent in what they don't need a prior authorization for, and the timely payment or processing of claims. And Medicare Advantage plans are private businesses that don't behave the same way. So we're looking at how long does it take a patient to get a prior authorization by individual plan. We're looking to see how long that delays care. We're looking to see what care is denied that never gets authorized. And we're looking to see how long it takes for us to get paid and what we actually do get paid, so that in the future we can decide if we want to continue doing business with all of the Medicare Advantage plans. If we were to make some change, we would do that early enough in a year that we would be able to communicate our intent broadly to patients and people that we serve, so that when open enrollment happens at a future time, people would be well informed about their options. It's not something we would do quickly or without a lot of communication. Right now, we're just on that initial stage of understanding what the impact of patients and our health services are. I'll start pointing us a little bit more to the future. So last summer, our board, a couple members of the hospital district board, our medical staff, so leaders from the physicians, got together with our leadership and started really asking ourselves, what do we want to be focusing on in the next 1 to 3 years? And so at the end of December, our board approved a set of strategic objectives for the hospital. And if you go to the next slide, you'll see at a high level what those objectives are. And then the slide after this, I'll show you a little more detail. The couple of questions that we try to answer for ourselves are, who do we serve? What is it at a core level that we provide, and how do we fund that? And so there's really two groups of people that we think about in terms of service. The first group are those that are part of the communities we serve, so those that may live or work in the area. The second group are those that may be traveling through or work here but don't live here and may end up injured or hurt or need some type of urgent or emergent services. So for those who are part of our community, we don't just look at our responsibility as to wait for somebody to show up sick to get care. We're looking more broadly at how we help create the conditions where people can achieve their ideal state of health and what our role in that is, which is a very different lens to look through than just saying we're going to be here when you're sick. And then again, for those who are traveling or work in the area that may have more urgent or emergency needs, that's an important part of what we offer in the community as well. You can see there's some areas where we expect to receive funding from, and I'll touch on that before we wrap up in a few moments. The way we started thinking about achieving those broad objectives are by first focusing on the people that work in our organization and the level of service they provide to one another and to people who come into the hospital. Having people who are great at what they do, who are aligned with our mission, well-trained and working together, allows us to continue to focus on safety and quality. And safety and quality are two different things in healthcare. Safety is when you come in, you shouldn't have something happen to you that you didn't expect. It should be a safe environment. It's also a safe environment to work and to be treated well. Quality is having the expected procedure work or other things done and have that be at a high quality. And we believe when we have the right people doing the right thing, we will be able to grow services and offer more to people that live and work in the community and ultimately help provide world-class care close to where people are. Again, I'm not going to go through in detail, but in the people service area, we're focused very much on continuing that great work of employee retention and engagement. In healthcare, again, to create that quality and outcome, we want to have a high reliability organization, which is a lot about how people work together and add value through their work. We're looking at national recognition for both patient safety and quality. There's a lot of things that we do, and internally we know we do them well, and we want that story told, and we want to hold ourselves accountable to providing that. And then in some growth areas, we'll talk specifically about MANCUS. We want to increase the number of people that choose to have a primary care provider who's on our medical staff. We want to increase the use of existing services, and that's really important in being able to grow. If there's things we already have purchased, already provide, already have the expertise to do, and more people seek us out for that, we don't have to spend a lot of money in capital or new equipment. And so just from a sustainability viability, that's a really important piece of how collectively we as a community accomplish that. And then in addition to that, looking at where it makes sense to increase specialty care, where we can make that investment on the front end. So talk briefly about MANCUS. So we've been working to expand services. And again, I want to thank Heather and the team here. We've been talking about this for the last several months. So a couple things that have come to fruition at the beginning of this year. We've started offering prenatal care at our MANCUS clinic. So on Fridays, Dr. Megan Viquez is staffing the clinic. We had our foundation do a lot of work to raise funds to purchase equipment that will allow us to do that. So we purchased OB ultrasound. It's the same quality and caliber that we have in the clinic in Cortez. So regardless of which clinic a mother may be going to, they're going to have the same access to the same equipment and technology. And then there's a few other pieces of equipment that came along with that or that are coming this spring. We also opened back up on Fridays. So with Dr. Viquez being there on Fridays, it's not just a prenatal clinic, it's a family medicine clinic. And collectively, the physicians and providers here are doing same day or walk-in appointments. And so if somebody needs to be seen the same day, they may not have access to their primary care provider that day, depending on who's working, who's not, schedules and things like that. But being open Monday through Friday will hopefully offer the opportunity to receive care here, not to have to travel to Cortez or Durango for things that could be seen here. And then again, we've had 2 generators sitting in the community for some time, but they weren't actually hooked up. One was at our clinic, one is at the building where we house our ambulance. And so again, the town contributed a portion of the funds to get those hooked up. Our hospital district contributed some of the funds to do that, and then Southwest Health System did as well. You might say that that's really nice. How often does the power go out and what's the consequence? You're not running an emergency room. The big deal for us is we hold vaccines in the clinic in Mancos so that people don't have to travel to get their routine vaccinations. And anytime the power goes out, the risk is that we won't be able to maintain the temperature. And so we actually have to, whether it's the middle of the night or the middle of the day, take those vaccines and race them over to Cortez so we don't lose them. And so having that backup power is actually really essential just in keeping the primary care services we have. And then we continue to offer pharmacy pickup from a retail side. So if you or a family member have a prescription that's filled through our pharmacy, you can request that to be picked up in Mancos, and we courier it over here and have that available for you. This is the cohort of folks that we have working in Mancos. So Dr. Eversol's been here for a couple years now, alongside Karen Siegel, who's done just a great job of keeping that clinic viable and open for the last several years. Heidi Larrick was our emergency room director, finished up her family nurse practitioner degree, and we were really excited for her to launch her career here. So she's going on a little beyond her first year anniversary. And as I mentioned, Dr. Viquez joining them on Fridays. So I'll come back to the funding question that I had in kind of our upcoming year and some of our plans, and share with you some of the conundrum about the conversations that are happening in Washington and how that affects us. So on the left is where we expect to have funds coming in 2025. We expect to have about $85 million of revenue, out of which most of that is related to people in the community choosing to receive care somewhere in our health system. The hospital district expects to collect about $2 million in sales tax, which gets passed through to us. Those funds are dedicated to paying the bond debt that built the medical office building and the new part of the hospital. So we don't get to use that for anything, but it's really important in how we pay for the buildings that were built. And then you can see we've got $250,000 in philanthropic giving. When I share that number with our foundation, they said, wow, that's a really big number. We haven't raised that in a while. And I said, that's okay, we can do it. And they agree. But it pales in comparison, both of those numbers pale in comparison to the importance of people choosing to receive care within their local hospital, their local health system. I could run the hospital for another year without $2.25 million. I would prefer not to, but I keep the doors open, the lights on, and all of that. If we don't have the large portion of that $83 million, it gets really hard really fast. So if you look at the right, now this is where that $82.8 million, where we expect it to come from. And the one number I'll draw your attention to is 17%. That's the percentage of cash we expect to collect that rolls through the Medicaid program. And so if I zoom way out, right now in Washington with a new administration and a lot of focus on cutting costs, there's not a lot of conversation about touching the Medicare program that funds older adults, 65 and older, and some disabled people. But there's a lot of conversation right now on how to reduce spending in Medicaid. And that federal dollar flows through the state, which pays for a lot of things. A lot of times what I hear is, well, that's the program that takes care of the less fortunate, those that don't have the means, et cetera. When I see where we're expecting to collect money, think about in your household if you had 20% less revenue coming in. So for us, we're not going to stop taking care of somebody because of who's paying the bill. But if the whole Medicaid program went away, which I don't expect that to happen, but if it did and we had 20% less revenue effectively, it's not about, well, we're not going to do this for those that are less fortunate. It really becomes, what things can't we do? And everybody in the community loses. It doesn't matter. Elon Musk could walk in the door with his checkbook and say, what's it going to cost me to get this? And if we don't have a physician, a nurse, a tech, somebody to run our CT or MRI or the piece of equipment that needs to be up to date, no amount of money in that moment when you need healthcare will get you what you need. And so if there's a substantial change to the Medicaid program at a federal level, that's one of the biggest threats to healthcare delivery in rural communities right now. Because it won't be a question of, well, what things do we do less of? It will be what things can we just no longer provide. And it doesn't matter who you are or who's paying the bill, it just won't be available. So as you start thinking about your advocacy work, with CML and, on your own, be thinking about what the role of Medicaid is in this community. Again, as one of the 2 or 3 largest employers in the county as a whole, we're also a really important economic engine for the community in addition to a healthcare provider. I won't bore you with the details of this. We've talked a lot over the last 2 years as a health system about days cash on hand. The short version of a longer story is to the far right. We have 93 days cash on hand at the end of October, which is the last quarter we reported it to the banks. Of that, 74 of those days are unrestricted, and we have to maintain a total days cash on hand of 60. We've renegotiated that with our bondholders, and we have some restricted funds that count towards that 60 days, but we tend not to think about it because we want to be able to use them for their restricted purpose, and we want to have enough cash unrestricted to meet our covenants. So for the moment, we're in a good place for cash. We have some intended use for that. So as we go through 2025, if you're following what we're doing, you'll see that cash actually erode, but it's intentional and planned. And we put ourselves in a position where we can make some investments. We have a few new members of our board. So I won't list everybody up here, but so Shirley Jones has been a longstanding member of the board. She'll finish her last year and term out at the end of this year. She's our board chair and has been fantastic to work with. And then David Dahl's a new director. Dr. Dahl's a retired anesthesiologist, but he's also served in administrative and leadership roles of large hospitals and systems. Both of them live in the Mancos area, so that's why I share with you. You have 2 people on our board that are very interested in the town of Mancos. I don't believe they live in the town, but they live just outside and are very interested in all of our success. Last 2 slides are just going to be patting ourselves on the back or tooting our horn a little bit. So there's a standardized survey that if you come spend the night at a hospital, doesn't matter what hospital in the country, you'll have an opportunity to give feedback. It's the same questions that are asked no matter what hospital you're in. One of those questions is, would you recommend the hospital to a friend or family member? And I can't think of a better endorsement of the care somebody would receive than to say, if it were my loved one, I would trust this facility to take care of them. And so those percentages are percentile ranks. So I go back to my middle school basketball, shortest to tallest. I was the shortest, so I was picked last. But in this case, we want to be the tallest. And you can see for really the last year that we've collected data, we've been somewhere between the 70th and the 90th percentile and finishing up the 3rd quarter of last year at the 90th percentile. And this is of all hospitals in the United States. Big, small, doesn't matter. People are getting great care and happy to recommend us. And then lastly, there's a national rural rating system for hospitals where we submit our quality and patient satisfaction data. Small community hospitals have less volume, so this rating system does a really good job of not trying to compare us to big hospitals that have large volumes of data. And then they issue a rating. And so we're one of, I think it's about 30 some hospitals in the United States this year that achieved a 5-star rating through that system. Again, that's the great work of the people that we have. Last thing I'll share is, on the left is a picture of what it looks like for us as a hospital to do this all by ourselves. It's not really beautiful and it's kind of plain. And over on the right side is a beautiful picture. Imagine if you were standing on the Kansas border looking west, you'd see all parts of Colorado in that picture. But this is really about what it looks like when we work together as a community, when our rural communities work together to advocate for rural healthcare, and even when the big health systems across the state, when we come together and have a vibrant healthcare system in our state. So happy to answer any questions. Again, I appreciate your time and the opportunity to provide you with some updates.
Thank you very much.
Thanks. You're welcome.
Any questions?
Thanks, Joe.
Thank you. I'll hang
Thank
around
you.
for a little bit and love to hear what you guys are
All
doing.
right.
Thank you.
Joe.
Thank you very much. All right, audience business. I don't see anyone. Unless you want to say something. Okay, so we're going to go ahead and skip the whole thing about audience business. Seeing no one here. Montezuma County Commission update. No one's here. Announcements.
I do have a few announcements. I don't know if you have any announcements. Should we go first? No, you're good? Okay. So I just have a few. The Planning Commission is reviewing a draft ordinance to prohibit flagpole lot configuration within the town. We talked to you about this a little bit with those 8 items. So they did discuss it at the P and Z meeting, and they would like to prohibit those lots. So we are going to give them a draft ordinance with that language. They will be making a recommendation, and once they finalize their recommendation, it will come to the board for review, discussion, and final decision. Planning Commission is just doing the due diligence, and then they'll send the recommendation to you. So when that's ready, you will see that. The Memphis Conservation District, as a refresher, we do budget money every year to share a staff member with them, and in return, there's no amount of money that we can pay because the collaboration is out of this world. With regard to water or landscaping or any odd questions that I may have. So they actually applied for a grant from the Bureau of Rec for some of their projects. They included one of our projects, which was those river upgrades at Cottonwood Park. They received the grant. So I believe it was $600,000. What I didn't get in the email is that the entire grant or just the Cottonwood Park piece. But once we have more information, we will be bringing that back to you. We are not executing the grant contract on it. But I just wanted to let you know one of those items that we've been talking about for a couple of years. They took the initiative. They said, "Do you mind?" And I said, "No, how about it?" And so they did get that right. The other thing that they've done is we have been talking to them, and Justin and I will be meeting with them to discuss the landscaping of the new marshal's office when it's complete. So they also took the initiative to apply for a $2,000 grant through Protect Our Pollinators Habitat Fund to assist with the landscaping over there. That grant application is due January 31st. They're doing all of the work. They're just going to say, "Yay, we got the grant," and that was it. So once we receive that grant, thinking positive, the only requirements are that we keep the landscaping in place for 3 years and that we manage it on. We already have planned that over there. It will be water-wise landscaping. So I will keep you posted on that grant process as well. But I just want to say thank you to the Memphis Conservation District because they always go above and beyond. If we need anything, if they need anything, they take the initiative. The collaboration is just great. So the Memphis Marshal's Office is scheduled for completion in late February or early March. We have ordered a plaque for the lobby of the Marshal's Office similar to the one out in front of Town Hall that lists the project and the trustees and who did what during that. Once construction is done and we're ready for a public tour and a ribbon cutting, we will be in touch with you all to schedule that. But we will have a public ribbon cutting that you all will be leaving. So, but I just wanted to let you know we're getting close and we'll work with you on a ribbon cutting date when that comes. Finally, the board meeting is tomorrow night at 5:30 p.m. at the Dolores Community Center. So I will email written directions and the email back or the property address to you all for those of you who signed up and choose to go. And that is all I have. And I did ask staff if anybody else has any announcements, so I'll announce it to you.
Anyone on the board? Okay. All right, so we'll close the announcements, and now we move on to item I on our agenda, consent agenda items, and those include tonight approval of the minutes of January 8, 2025, and the Memphis Conservation District update report. I would entertain a motion for approval of the consent agenda items.
To approve the consent agenda items.
Okay, we have a motion. Do we have a
Second.
second? All right, we have a motion and a second. Will the clerk call the vote?
Trustee Andreas Esparza. Trustee David Payton. Trustee Daniel Hennett.
Aye.
Trustee Ryan.
Aye.
Did I do that wrong?
meeting, it's just.
Oh, just a group, okay. I'll have to iron that out. All right, moving on to J. Discussion and action items. Number 1 is the hazard mitigation plan update letter of intent.
So we currently have a hazard mitigation plan that was adopted in 2020 by all municipalities and entities in Montezuma County. This effort is led by Jim Spreckman, who's the Montezuma County Emergency Manager. It was adopted in 2020. It must be updated every 5 years. So we are going to be starting that process again. And the county is applying for a grant. So what he's asking for is that we all sign this letter of intent to get the grant some teeth, because we're going to have to update it regardless of what the county is. So gave you a draft letter of intent for your review, and I'm asking that you authorize me to sign that letter. As a side note, I did give you a link to the existing hazard mitigation plan. It was very, very big, just so I didn't include it. But it is on the Montezuma County website on the emergency management page. If you would like to go there.
All right. And so, let's see. Do we need to take any action on that one?
I do need a motion to authorize the town administrator to sign the letter of intent to update the hazard mitigation plan for the town.
All right. I would entertain a motion in a second.
I'll make a motion to authorize the town administrator to sign the letter of intent to update the hazard mitigation plan for the town of Memphis.
Second.
All right. We have a motion and a second. Will the clerk please call the vote?
Trustee Andres Esparza. Aye. Trustee David Payton.
Aye.
Trustee Daniel Hennett.
Aye.
Trustee Nichols.
Aye.
All right. Moving along. We now are on item 2, ordinance 786 series 2025, amend the town of Memphis zoning map at 127 Bauer Avenue.
Yeah, so at the January 8th, 2025 board meeting, you all approved the rezone of 127 Bauer Avenue from commercial to downtown mixed use. So we approved the property at that time. Now we need an actual ordinance to amend the town zoning map so that we can send that to the county assessor. So this is the final item in that process.
Okay. And the motion is to approve. And so I would, or the recommendation is that we move to approve. So I would look for a motion and a second.
I make a motion we approve ordinance 786 series 2025, an ordinance amending the zoning map of the town of Memphis with respect to 127 Bauer Avenue, Memphis, Colorado.
I'll second.
Okay, we have a motion and a second. Is there any further discussion on this item? Okay. All right. Call the vote.
Trustee Andres Esparza.
Aye.
Trustee David Payton.
Aye.
Trustee Daniel Hennett.
Aye.
Trustee Nichols.
Aye.
All right, thank you. Now we are on item 3, MOU with Montezuma County for GIS services.
This is a piece of housekeeping business. We received an updated MOU from Montezuma County. So in 2009, we all signed individual MOUs. Memphis and Montezuma County, Town of Dolores and Montezuma County, etc. Montezuma County houses and holds all of our town records. So anytime that rezone, we send that information to Montezuma County, they update the GIS, the clerk keeps the records, and if we ever need it, we go get copies of the records. If citizens need records for their own property, they go to the Montezuma County. We do not keep them here. So it is time to re-update the MOU for the GIS services that Montezuma County provides for us. We did have some questions. David looked at it, and we did have some questions. There were some changes. Nothing too substantive, but there was a fee discussion. So I cut and pasted my questions and the county's response so that you could see, where we were confused and how they responded to us. I have no issue, based on their responses, with requesting and recommending that you authorize the mayor to execute the updated budget. And the other difference, not a significant difference, is instead of the town of Memphis and Montezuma County having an agreement and City of Cortez having, all of us will have one. So if you have any questions, I'm happy to answer them.
Any questions?
At the very end, there's language about getting a full copy of our GIS database annually. Do we currently do that?
We do not request it. We can request it, but we have not requested it. Terry has, our public works director has access, for example. He can log into WGIS and see where, because they keep our infrastructure updates. If we update a line, if we install fiber somewhere, we send that information to Montezuma County and they update the maps and take care of it. We have the option, but we've never had a need to. If we ever have a project, we use it.
Do we know where and how they store that information?
Jim McLean is their IT director.
Uh-huh.
They do have multiple backups. He is very much into redundancy. Because that was one of my questions was, if we need to be responsible for storing this, I needed to know that. I don't want to say it will never happen, but we have had the same agreement with them in the 17, for the entire 17.
Yeah, I'm thinking, you know, like we just watched Los Angeles burn, who would have thought? And if all of their backup copies are in Cortez.
They have some cloud copies. I don't necessarily want to give up their information.
Oh, yeah, sure.
But they do have multiple backups in multiple locations, I guess we'll say.
Okay.
Well, aren't they using Microsoft like everybody else? I mean, most stuff is backed up a whole bunch of times anyways. It's not local anymore.
The servers.
I don't know exactly what systems they use. And I'm happy to get, or to request that Jim come over, or sorry, the IT director come over if you are interested. But we have confirmed that everything's moving to browsers.
Yeah.
Yeah, it's all,
Like election cameras.
it's all in the data center.
You are used to have to do multiple hard drives now.
Yeah, it's all with Amazon.
Yeah.
Yeah.
So they
AWS.
do have multiple backups in multiple locations, and I'm comfortable with it.
Okay. All right.
So,
Yeah. Okay. Any other questions? All right. I would entertain a motion and a second.
I move to approve ordinance 786 series. Oh, never mind. I don't. I'm reading the wrong one.
Nope.
I move to authorize the mayor to execute the memorandum of understanding with Montezuma County for GIS services.
I'll second.
All right. We have a motion and a second. Thank you. Will the clerk please call the vote?
Trustee Andres Esparza.
Aye.
Trustee David Payton.
Aye.
Trustee Gavin Lennon.
Aye.
Trustee Manning.
Okay. The next item on the agenda is the revised IGA with Montezuma County for cooperative planning efforts.
So I'm going to kick this off, and then Jason and I will tag team depending on what questions you have. This was originally presented to you at the September 11th, 2024 board meeting, and the board approved it and authorized you to sign it and enter into the MOU for these planning efforts. We received a revised copy from a Montezuma County staff member that made some changes that I feel, which is why it's back in front of you, were substantive enough that I wanted to review and read. What they did was they changed all of the shalls to shoulds, which doesn't give me any room. The other thing that they did under it's page 23 of your packet, section 3 of the goals, you will see that they removed the goals to preserve open lands and agricultural land uses around the town and within the county. And they removed the goal to protect local culture, urban and rural character, natural resources, public lands, and conservation areas. I do not have an opinion on those, but like I said, I did feel that the changes to the original agreement were substantive enough that it should come back before you for review and discussion and feedback. If you choose to approve it, great, I'll execute it, but I just wanted you to see it and give me some feedback.
Do we know anything about why they changed the following terms? Shall have the meaning to should have the meanings?
Yeah, it just seems really like
I do
non-legalese.
not. I reached out via email to say, hey, and then Mr. Dietrich responded and said Commissioner Candelaria made these changes. And so that was the response.
This is what he wants it to mean?
Yes. They wanted
Well, that's what
from
should
shall
means.
to should.
No, I mean, when you say should,
Yes.
it should mean this, not it does mean this. So that is just completely improper language to me, as far as it.
David, is there anything legal?
Right.
Shall?
Should sounds like they'll try.
Right.
They'll try.
It's not a requirement.
It's not enforceable.
Which is really strange.
Right, why would they? Yeah, so I'm with you on that. Why would they?
The Board of County
What's going on
Commissioners
here?
should mean Board of County Commissioners.
Right, but it doesn't? Or, where's the question mark? It just doesn't, it doesn't make sense.
It seems like they stripped it of all accountability. My personal choice would be to move it back to shall.
Same.
If that's in consensus, I can absolutely present that information and we can.
I mean, I'd love to have the goals 6 and 7 to remain.
Yeah, I think beyond the shall and should, I would agree with 6 and 7 remaining on if possible.
So shall, should remain.
Shall
Should remain.
Yeah,
I like it.
Shall remain.
he's gonna love getting this back.
Shall should remain.
Yeah, I'd love to see that either.
And we do have item 6 and 7.
Yeah, can you please see this?
At least part of them. I mean, in terms of 6, preserving open lands and agricultural land uses, if we're considering annexing and allowing people to develop, then those would be negated. And this is an intergovernmental agreement, not just what the county's gonna do. So I don't mind if we lose 6. But totally cool if more people would like it back. But in 7, we get that protect local culture, urban and rural character, and we've kind of gotten rid of that kind of language in a lot of our documents. Preserving the historic rural character, and it's like it kind of mires us in the past. And so those first 2 items I'm not concerned about losing personally, but natural resources, public lands, and conservation areas I think should remain for sure.
And, removing 6 seems contrary because last time we had a county commissioner update, they told us about how they're trying to make sure that the zoning and solar farms keep agricultural land agricultural.
Mm-hmm.
And then they remove the goal to preserve agricultural land use.
Mm-hmm.
So it seems really contradictory.
I'll say that was something else.
Well, now that I think some of the shoulds could possibly remain, but some of them should be shall. I mean, as I'm going through more of them, I'm like, okay, that could be, maybe that's one that, maybe you could have a little flexibility on, but, like timing requirements, like you got 14 days to give us I don't know, you should give us 14 days. Well, if you give us 2, so you shall give us a certain amount of time, whereas, maybe you should get us involved in this, or, I don't know, maybe I don't know why all of them were changed, but
Yeah,
The master plan.
maybe you can go back
should-
through and kind of say, this should be a requirement, this should be a requirement, this should, maybe kind of pick out some things that make sense
You
to,
don't really see shoulds on like legal documents.
Yeah,
or
like,
IGAs.
not
It's
at
kind
all.
of a weak move. You can tell them that.
yeah, well, I'm just trying to like be cooperative. They obviously wanted it this way, so maybe we meet them halfway. It's kind of what I'm thinking.
Just takes all punch out of it.
like,
Well, right.
yeah,
so
because
you gotta put the punch back where we need it.
just even on page 2 of 4 of the document in section 4, any adoption of an amendment of the map boundaries should be made after public hearings. Well, it shall be made after public hearings, because why would you make it before?
Yeah, right.
You know, like,
that
it's
language can't be solved.
public. So some of them just don't make any sense.
Yeah.
Other than just lack of accountability. And it just seems like we keep getting burned in these kinds of agreements with other entities through the decades. So disappointing.
It's straight to a legal loophole in my mind that they can drive right through if they want to.
So,
What's the point of the agreement then if it's just like, oh, well, maybe, well, then why are we writing it all down then?
Yeah.
Why not just leave it as,
Exactly. Well,
right.
if you feel
What are
like
we
it.
agreeing to?
We're relying on them to have our best interest at heart. I'm not sure.
Yeah. And that has backfired.
well, and so I'll review this, and so for example, in definitions, shall needs to remain. It needs to be clear.
Yeah, it's a definition.
And shall have public hearing. I'll review this and just based on my experience,
Yeah.
figure out the shalls and the shoulds, but I would like consensus actually on number 6 and 7 from you all. And then we should negotiate. So what I have so far is taking out number 6, leaving number 6 removed. And number 7 should state protect natural resources, public lands, and conservation areas. That's what I heard. I just need to make sure I heard
Wow.
it correctly and you all agree.
That's what I said.
It was very
The other
direct to
guys.
the point, which is why.
Yeah. The other guys were saying they would like all of 6
You
and
want
7.
all of 6 and 7 in there, I'm fine with that too.
I think I'm okay with removing 6 and keeping the last half of 7, like Cindy was talking.
Anyone else? Anyone?
Yeah, I like if you say protect natural resource, public lands, and conservation areas, that seems to kind of wrap all of 6 and 7 up in my mind.
Yeah.
So, I don't know. I think that's a pretty common thread in Montezuma County, protecting natural resources and public lands. So, it's kind of surprising to see that was struck. But.
Okay. Nick? Anything?
I'm good with
Okay.
David's changes.
All right.
Yeah.
Cool. So,
So I would actually say, I don't necessarily need a motion. What I have is consensus. I only need a motion to execute.
Yeah.
I don't need a motion not to execute.
right.
So I have my marching orders. I will negotiate with Montezuma County unless we have a final document that we all agree with. We'll bring it back to you, and then at that time, I'll need a motion for signature if you agree with it.
Okay. All right. So we are on to item K, items for our February 12, 2025 meeting. And so we have a workshop, November ballot question, information and discussion. Our consent agenda will be looking for liaison reports for the Mancos Planning Commission update, Mancos Creative District update, Mancos Valley Chamber update, Mancos School District update, and anybody else that's got any other updates that may need to happen Heather.
Would you like me to add the student liaison update to the consent agenda?
Yes, I
Yeah, think
would.
That's a nice.
That would be great.
Feature.
So usually.
Maybe some homework.
I send an email to our liaisons and say, hey, I need a written report by this date for this packet. If you don't have a report, you just reply back to me and say, I don't have a report, I don't include it. So it's not gonna be a mandatory report, but if you have anything you wanna share with the board, that's your opportunity.
Yeah,
Yeah.
nothing
And you can
too.
even respond to me in an email and I'll just put that information in the packet. We can talk more about that, if you, outside of this meeting, but I don't want you to think that you have to give us a mandatory written report. That's not what this is.
Yeah. 40 pages.
It can be bullet
Tomorrow.
points, too.
Not
Yeah, it's like, wait, that's work. No. Okay. Good call. I like that. And then comprehensive plan staff update, 2024 unaudited financials and work plan update, and then an item about the Mancus Gear Library. Is there anything else?
Not right this second.
Okay. And then if anything else comes up between now and then, you'll add it.
And I'll send you Brent the agenda
Great.
before finalizing.
Perfect. All right. Well, seeing no other business, I would entertain a
So
motion
moved.
for adjournment.
Okay.
All right, we are adjourned at 8 o'clock.